So today, in series of Toplexis scale interviews, we have with us Dr. Bharat Dave, who is from Ahmedabad and is a spine specialist. Thank you, Dr. Bharat, for this interview. So shall we start?
Yeah, please. Thank you.
So my first question is, what is osteoporosis? What factors determine bone strength?
Osteoporosis, it is weakening of the bone as age increases. After 35 years of the age, the bone loss occurs, and by the age 65, 70, we would have lost the 50% of the bone density. So basically osteoporosis means the decrease in the bone density.
Okay. So my next question, what is the complication of osteoporosis?
As any structure, it weakens, it is likely to, particularly the bone, it's likely to fracture and it is likely to collapse, and the height will decrease. So the most common complication that we see will be the fracture. It could be in the wrist, it could be in the hip bone, or it could be in the vertebral body.
Okay. So what are the signs and symptoms?
Signs and symptoms of osteoporosis, as such, if you ask me, there are no signs and symptoms unless patient gets significant pain and fracture into the bone. But the first sign could be decrease in the height. We do see patients walking around with the loss of the height with a bit of stoop posture, and that could be the first sign. So if I may suggest that we should be, putting on the back of the door the height measurement of elderly woman or man. That way we will be able to judge the loss of the height, and that could be the first symptom of the osteoporosis. Pain, bone pain, loss of hair, weakness, fatigue, muscle pain, these are the other signs as well, but this could be in any other medical condition too.
So doctor, according to you, what are basically the risk factors and the causes?
Basically, osteoporosis, like diabetes, blood pressure, it is an age related disease. So you can't really stop osteoporosis, but if you have strengthened the bone when you are young, we call this as a bone bank concept. So if your bone is strong, and by the age 35, if your bone density you have increased by doing the weight bearing exercise, by games, by outdoor activities, by physiotherapy, by aerobics, then the bone density is high, and when you start losing it, you lose it at a very, very late age. So the complications related to that occurs quite late.
Okay, so what will be the treatment guideline?
The treatment guideline would be active life, try to do walking, weight bearing activity, because if you do the weight bearing activity, then only the bone density increases and bone loss does not occur. So basically what you need to do is to activity and do not have sedentary life and have the balanced diet.
Okay. So thank you, doctor, for this insightful discussion.
Thank you. Thank you.